Okay, if you're a discharge planner or a case manager, you already know the pressure, right? The charts are just piling up, the phone never stops ringing, and your main goal is to turn over those beds safely and, of course, efficiently. But what happens when you send a referral out to a home health agency and all you get back is, well, nothing, just silence? That silence, it's a huge breakdown in that critical hospital-to-home transition. So today we're going to talk about what really makes a home health partnership work, and what you should really be demanding from the agencies you partner with. And we'll look at this through the lens of an established agency right here in South Florida, Focus Family Care. You know this feeling all too well, that waiting game. It's not just frustrating for you, it's a real point of failure in the system. Honestly, every single delay just adds risk for the patient and creates a major bottleneck for your entire department. And we all know it. Preventing readmissions, it all starts with a discharge process that is seamless and totally predictable. A real partner gets this. They don't just take your referral, they actually become part of your workflow, like a reliable extension of your own team. And you see this with experienced agencies, especially in busy areas like Palm Beach County and right across South Florida. They've fine-tuned their processes for years to handle the exact pressures you face every day. You know, a big part of that process is just simple transparency. A great partner makes it super easy to get a hold of them. You shouldn't have to navigate some complicated phone tree or fill out a web form just to get an answer. Their info, just like you see here, should be right out front so you can connect the moment you need to. So the second you send that referral, the clock officially starts ticking. And you really only need to know two things, and you need to know them fast. 1, can you take this patient? And 2, when can you start? Every minute of radio silence leaves you, and more importantly, the patient's family, completely in limbo. And that brings us to a really crucial benchmark, response time. Look, during business hours, the standard for a top-tier partner really ought to be a response in about 30 minutes. That's what agencies like Focus Family Care shoot for, a straight, clear yes or no on whether they can staff the case. It's all about getting a fast, honest answer so you can keep things moving. And what about those really urgent cases, the ones that have to move now? A great partner can often pull off same-day assessments. This is all about being responsive to your need to manage bed capacity and get that patient home safely without any unnecessary delays. All right, let's switch gears. What about your more complex patients? You know the ones, those with high acuity needs that, let's be honest, not every agency can handle. Do you have that one go-to partner you can truly trust with these tough cases? This is where you really see the difference between agencies. The ability to manage these high acuity cases right at home, it's a total game changer. We're talking about advanced wound care, complex respiratory support for patients with trachs and vents, home IV therapy, and even that highly specialized pediatric skilled nursing. Agencies that are equipped for this, like Focus Family Care, can literally prevent those long, drawn-out hospital stays for medically fragile patients. And maybe just as important, a partner you can trust is upfront about what they can't do. If a case is outside their scope, they tell you immediately. No wasting your time, and definitely no last-minute surprises. Okay, let's talk about one of the biggest frustrations I hear about: sending a referral into what feels like a black hole. You hit send, and then you're just left wondering, did they even get it? Did they call the family? Is care actually going to start? This is exactly why a closed-loop communication process is so critical. You should never, ever be left in the dark. A great partner makes sure you get confirmation the referral was received, then a clear acceptance, then the scheduled assessment time, and finally, a confirmation that care has officially started. The bottom line is you should always be in the loop. And, you know, this also shows that communication has to be a two-way street. If you need a status update, you shouldn't have to jump through a bunch of hoops. A simple, direct line of contact, just like this, is a true hallmark of a partner you can rely on. So all of this really builds up to the most critical piece of the puzzle, reliability. Because, you know, the single most damaging thing an agency can do is accept a patient they know they can't reliably staff. It just completely erodes trust, it puts the patient at risk, and ultimately it reflects poorly back on you and your hospital. This right here, this is the core philosophy you should be looking for. It's a simple promise. If an agency accepts your patient, it means they have the staff to provide consistent, reliable care. A solid reputation is built on one simple idea. They show up and they follow through, period. So when you start to put all these pieces together, you really see the difference between a simple vendor and a true partner. See, a vendor, they just check a box. A partner, on the other hand, is genuinely invested in your hospital's goals. A vendor relationship feels transactional, right? It's reactive, but a partnership, that's collaborative. It's proactive. It means you're working with a team that is just as invested in getting positive outcomes as you are.
And this is exactly why it matters so much. A true partner aligns with your most important goals, reducing those readmissions, boosting patient satisfaction scores, and supporting the quality metrics that your department is judged on. They really do become an extension of your own care team. So for all the discharge planners and case managers out there in Palm Beach County and all across South Florida, finding that right partner isn't just nice, it's absolutely essential.
I mean, just imagine making that transition from the hospital back to home the smoothest, most predictable part of your entire day. That's what a real partnership is supposed to feel like. So, if everything we've talked about today, that responsiveness, that clinical strength, that true partnership mindset, if that resonates with what you're looking for, it might be time for a new conversation. You can reach out to a team that really gets it, like Focus Family Care, to talk about your needs. Their number is 561-693-1311, and the website is focusfamilycare.com. So I'll just leave you with this one question to think about. Here in our community, when you think hospital to home, who should be the very first partner that comes to your mind?